through the intended process called differentiation false.
False, yes.
Am I going to read the whole thing by myself?
Yeah, because Prema wasn't there, she did not do the class, so we can do it after we finish this lecture today. And we'll go. Okay? Because she wasn't here, so she's the only one. Amritpal is not in the class today. Okay. I'm just trying to find the text, growth and development in my book. So let's go over the key terms, which will help you understand the different levels of development. Okay, on growth and development. Adolescent. Can you read that part, Tim? You have the key terms, no? Yeah, adolescents.
Sir, are we talking about chapter 31?
Yes.
Okay. So you want me to read these questions from workbook?
No. The key terms of the chapter. Like in the beginning of your book, you see those key terms.
Oh, from the textbook.
Yeah.
Okay. Yes, I have textbook. Oh my God. It's too heavy.
So this will make us understand better, like which age is it's not that just knowing that what adolescence is like a teenager. Between age 12 to 18 are known as teenagers, adolescent. Infancy is the first year of the life. So these ones, the ones I'm mentioning, you guys need to know that because it's in your exam. What age is adolescence? Infancy is when the baby is born. It's known as infancy. Late adulthood, it's the age of 65. Late childhood is between 9 and 12. Those ones, menopause, you guys know, is the time when the menstruation stops. Middle adulthood, please make sure you know that one, is between age 40 to 65. Middle childhood is between 6 to 8. Newborn is the infancy, it's a newborn baby. Preschool is between 3 to 5. Puberty, it all varies on the individual when they, for the female, when they start getting the menstruation, and for the men, when they start, boys, they start getting the testes and the hair development. Toddlerhood between 1 and 3, and young adulthood is 18 to 24. Make sure you guys know these ones because there will be there'll be a choice, and then you're going to be matching with the answers. Okay. So the basic thing of the development is the name. Like since the baby, somebody is born until they die, there's different stages of development they go through. And that's what we're going to be discussing today, especially you guys are coming into healthcare. It's good to know these things. These are like the development process. And then you will also know the aging process, what changes they go through when they get older, different stages of development. Okay. So the growth refers to physical changes that a person experiences in and measured and occurs in a steady and orderly manner. Can you guys see my screen? Yeah, okay. Growth is the measured in weight and height. So when the person grows, they get taller, the weight increases. And then on the other, when they get old, they shrink a little bit and the weight starts to drop. Changes in appearance and body function also measure growth. So development relates to changes in psychological and social functioning. A person behaves and thinks certain way each stage of development. That's the most important thing you have to understand. That when when somebody is growing, their their knowledge increases. They are able to understand things better. Like teenagers, you probably have that common thing. Teenagers, and then you become adult. Your different level, different types of knowledge comes to you. Okay, although they differ, growth and development. Sorry, I'm just gonna enlarge it a little bit. Gas, no. Sorry, it's my dog. Quiet.
Access student not allowed. You need to register first.
Yeah, I'm gonna put him away in the kitchen. You stay there. Sorry, guys. He's just curious what's going on here. Sorry, I just lost my screen. Okay, so although they differ in growth and development, they overlap. So when there's a change, like for example, between 1 and 3, when it is toddlers, they change into preschool. They still have some in the changeover from one stage to another. They still be you probably will see the behavior or both ways. Sorry, I'm just going to set up my screen. minimize that. Okay, so although they differ in development, depends on each other. So as I mentioned before many times, that every individual is different. They develop differently. Their needs are different. So you'll notice that there will be some similarities, but everybody differs from one another. Occurs at the same time. So it is like development of your the changes of your physical body. The basic principles of the process is starts at fertilization and continues until death. So these are the different proceeds from a simple to complex. Occurs in certain directions. Occurs in a sequence, other pattern, and related. Okay. Each stage has its own characteristics and development tasks and guidelines. So each stage of the way, you probably will notice, and there will be different style changes that's going to occur from a toddler all the way to adult. Just pose me if you have any questions. Pagets, it was one of the psychologists who developed this.
You're not sharing your screen anymore.
Oh. You cannot see my screen. Can you see it now? You guys can see it now? Okay. So selected theories, the Piaget was one of the psychologists who developed of cognitive development. It was published in 1936, focused on children and birth through the adolescence. So he's the one who studied the different behaviors and stuff as the child develops into an adult. There's been different behaviors, different type of development. At the stages of development, there'll be different behaviors. Bigger basic assumption are children build their own knowledge based on their experiences. So when the child is growing up, the primitive part of the brain starts developing, and whatever they learn gets registered in the primitive part of the brain, like the bad words, the how to play baseball, how to music. So like you probably experienced that some music you had when in your childhood is reflected now, because as soon as you hear that music, you're gonna start remembering that music. It's already registered in the primitive part of the brain. Okay. The children learn things that they own without influence of adults and others. So that's why it's very important when they are growing, you feed them positive things. So they register the positive things. If they see negative things, they will register the negative. Selected theories of human development. 4 stages of development. A cerebromotor stage from birth to 24 months. That's when they start experiencing the taste bud starts growing. So everything they're gonna see, they will put in the mouth to taste it. Pre-operational stage from 2 to 7. That's when they start learning to, walk, read, write, ride bicycles, learning numbers and words. Concrete stage, which is 7 to 11 years old. So you can just mentally think about the development of a child when he's 7 years old to 11. They go to school, they learn, make friends, and things like that. Formal operation age is 11 years and older. That's when the major development starts, when they reach the puberty. Start getting some children, they start at 11, they can go up to 13 years old, depending on. They selected theories of human development. Stage 1, make sure you guys know this. At the stage 1 is trust versus mistrust. That's when they start developing that who to trust and who not to trust. You can see, like, when a toddler, like when they start remembering people, if they get a stranger, they will cry and they will not go to that stranger. But if the person they know, their mother, their siblings, they deal with them, that's where the trust is. They trust them. And then stage 2, autonomy versus doubt. That's when they start developing, like, what is right, what is wrong. Initiative and guilt. Other stage, that stage, that's when they start developing, like, what they're gonna do is right, what they're gonna do is wrong, how they feel, the feelings of things. And competence and inferiority, stage 4, that's when they when they grow older, they want to compete, they want to look better, they want to groom themselves, they always want to have inferiority, that they are better. Identity versus role, confusion. That's when I'm a male, female identity. That's when it develops. Intimacy, isolation. Intimacy is like, having girlfriend, boyfriends, and they want to isolate themselves because that's where the inferiority comes in. One of the most of the teenagers you'll see, they like to stay on their own or with friends. Yeah. And generativity and stagnation, and entreaty and despair. So these two come later in that, when somebody gets in their 20s, and like between 18 to 20, that's when you're going to see entreaty and despair. Okay. Any questions on the stages of development? So Erickson was another psychologist that he wrote many theories, which is now used in mental health and social development. Like, where if you guys proceed to nursing, you'll see lots of in mental health and social development, Erickson's theory. Yeah. So his theory states that the personalities. So everybody is worried about the personality, like how one changes the personality with different people. Like if you see a teenager, the way they behave with their parents is different than how they behave with their friends. It's different how they behave with the school, the teachers, and everything. Family background. Like, they start following their religion, they start following their culture. Environmental and life circumstances. The environmental factor is right now probably like if somebody is in a war zone in Gaza, a teenage, their perspective of development is different than what you and I are experiencing here in a peace. So environment has a big factor in development. Somebody coming out from a war zone, mentally they are very unhealthy because they've seen lots of trauma and life circumstances. Like, if you have a death in your family, or you get into trauma in an accident or something like that, that will affect, or you've been abused or you've been molested, that will carry a different perspective in your life than a normal person would. This will also will help you if you ever end up in a group home working as a caregiver. You'll notice that there's a lots of government funded, like Ministry of Children's Development. They have lots of group homes where the abused kids are put in there to have a positive life. So you probably, if you end up in a group home where there's mentally challenged children, this would be a very good thing. So for you to know, because you will understand what the different stages of development is. There's another psychologist was Maslow theory, and he's a very famous in healthcare. Like, more advanced you're gonna go, more theories you're gonna learn about his Erickson, Maslow. So this is just the basic for you to know. According to Maslow, the need of something necessary is desirable for maintaining the life and psycho well-being. Take yourself as an example. You want to better yourself in your life, get a steady job. That's why you guys are doing the healthcare assistant program. That's how people, like, they will do things to make their things better. They will take the environmental factors, get education, get better in their life so that they can have a better life. So that's what his theory states. Certain basic needs must be met for a person to survive the function. What are the, let's go. What are the main things you need right now to survive? Let's have a little discussion. What is the three main thing you need? You need oxygen.
You need food, water, oxygen.
Food, water, oxygen, and a shelter.
Yeah.
Those are basic. Those are the basic. You have those, you can survive. If you have shelter to keep yourself warm in a cold weather, protect yourself from rain, wind. These are the basic. So according to Maslow, these are the, like, if you research on his theory, he'll have a pyramid that this is a basic. Then once our basic need is met, then we go to the second level where we find job, we get money to better ourselves, and then it goes. Then you become once you are established, then you're gonna have a partner. You're gonna start a family. You're gonna have children, and then all of that's your social needs are met. So these are the stages of development. As older you get, the more needs are to make your life better. So according to Maslow, the certain basic needs must be met for a person to survive and function. Like right now, in the current situation, you need money, you need food, you need shelter. Like as the things change, our needs make. We all are immigrants. We came from different country. Why? Because we want to better our life. Needs are arranged in hierarchy in order to importance. Lower level needs at the bottom hierarchy must be met first. As I mentioned, your basic is you need food, water, oxygen, and shelter are your main. Once you meet that, then you're gonna go to your second level. Then you're gonna go third level, and then your fourth level where all your psychosocial needs are met. Any questions on this so far? Oh yeah, there's a pyramid, which I was. So this is what a pyramid is. Your fiscal, the main thing that is in a human development is your basic stuff, and then your safety comes second. Then becomes love and belonging. When you fall in love with a guy, then you're gonna start your own family. You're gonna have a companion. self-esteem. Self-esteem is one. Then will come self-esteem, where you will feel proud of yourself. Yeah, I'm educated, I'm making good money. You know, you're gonna do your hair, you're gonna do your nails, you're gonna do your makeup to make you sure that, you know, your self-esteem is there. And then self-actualization, which is like combination of everything. Do you want me to, you guys want to write this down, or you have it in the book? Okay. According to Maslow, the basic needs are from the lowest to highest point. First is the physical need, must be met first. Without the physical need, you won't be able to survive. Like food, water, oxygen, and shelter. Need for safety. You need to make yourself safe. Safety is second. Need for love and belonging. You want to feel, you want to have a spot of you in the society. The need for self-esteem, the need for self-actualization. These are all your, like from one stage to another to third, fourth stage. So now the development is birth to 1 year. Just imagine in your mind, like how a baby is born up to 1 year, the different changes, different developments that come along with it. The time is rapid physical, social, and social and development. So they start to experience the world. Maybe they won't be able to say it, but they're all experiencing what's going on. They learn how to walk, learn how to eat solid food, beginning to talk, communicate with others. Maybe they the words are not clear, but they know that the learning and development, how to communicate. Being emotional relationship with parents, brothers, and sisters. So as a baby, you know, if anything happens, the first thing they're going to do is cry, because they don't know anything else other than to cry to show the emotion. And developing stable sleep and feeding patterns. Neonate to newborn. Average length, you know, it doesn't, it all varies. Some are small, some are big. Weight from 320 to 300, like 7 to 8 pounds, but some are smaller, 3 to 4 pounds, and some are bigger now. The central nervous system is not well developed. The CNS. So that's why they will be. Do you know about that? There's two nervous system we have. We have a central nervous system and we have peripheral nervous system. Central nervous system works during the day. It releases a neurotransmitter known as dopamine, which wakes us up and keeps us active. The peripheral nervous system starts when it gets dark in the evening when you're ready to go. So the dopamine stops when you go, and then serotonin comes in, and that's what helps you to sleep. So remember, we have two nervous systems, the CNS and central nervous system and peripheral nervous system. Okay. So for the babies, the central nervous system is not developed, so they don't know when to sleep, when to wake up. They'll be up in the middle of the night because they don't know the difference, and the body is not producing the neurotransmitter that is needed for sleeping and waking. Movements of uncoordinated, coordinated and lack purpose. So the movement, they'll be walking around, they'll be doing stuff that does not make any sense. There's no purpose to it because their brain hasn't developed that much yet. Okay. So the newborns hear well, react in touch and pain. The hearing is the first thing that comes when somebody is born, and it's the last thing that goes when somebody is dead. If somebody is dead, they can still hear you. Then ear is the last thing they're gonna die. The hearing. Okay. So that we're gonna go intense when we're gonna be doing the theory on taking care of death. Yeah. Moro reflex occurs when the baby is starting by loud noise, started by loud, so that's called moro reflection. Rooting reflex occurs when the cheek is touched near the mouth and suddenly move towards the head. So if they touch the baby, they will move the head thinking it's the bottle or nipple to feed them. That's called rooting. Just know the standard, like what it's moro reflex, right? And routine reflex, sucking reflex occurs when the lips are touched. So if you put your finger on the baby's lips, they will start sucking on it. That's all they know, is that's their food. And gasping reflex occurs when the palm is stroked. So they will, if you put your finger on a baby, they will try to grab it. So these, just know this, what these things are. The newborn's head is large compared with the rest of the body. Okay. The trunk is long, abdomen is large, rounded, and soft. Newborn can see both, but vision is not clear. The vision comes after a couple months of being. First 6 month diet is mainly breast milk and formula milk because the body is not designed to digest solid food. The solid food adds 5 to 7 months. When they get the puree, boiled food, and care must be taken to observe allergies to food and products. So that's when you're gonna be starting to see if the toddler, the baby, has allergies, because you will see they will if they have hyper sensitivity, they will throw up. You're gonna see rashes. The first place you're gonna notice rashes is on the chest. If you start noticing redness on the chest, you know there's something wrong. Either the formula they're allergic to, the food they ate, also if they're on medication. That's when you start observing. Okay. So for the first month, can hold head up. So when you lift the baby, their neck gets solid, and then but it still be supporting, but they can hold their head up. 2 months, smile, follow a movement of the object. They start, when you talk to them, and they start smiling. 4 months, able to roll over and sit up, supported, moro and root and reflex disappear, and able to hold object in both hands. So they start holding. If you give them a shaking a candy, they will hold, or toy, they will hold on to it. After 6 months, 2 lower teeth come out, starts to chew, hold bottle, and sit alone. So these developments, they come up, and understands, and then at 10 year to 1 year, they understand the number of words, take few steps and walk. So they'll hold your fingers and they start walking. Some babies, they start walking at 9 months, some maybe 16 months, 17 months before they're going to start walking. So it's all varies on individual, like on the strength. Toddlerhood, 1 to 33 years. Growth rate is slower during the infancy, sorry, pardon me. Development tasks are tolerating separation from the primary caregiver. So when the child is up to 1 year, they like to stick to the mom. They want to have something, or once they reach over a year, they can start sleeping on their own without mom being present. Gaining control of bowel and bladder. So that's when they start, urinating and pooping on the certain time of the day. Using words to communicate, becoming less dependent on their primary caregiver. So that's when you train them, and they are less dependent on their caregiver because they are able to know when to go to the washroom and walk to grab whatever they need. toilet training comes in place. It's one of the psychological and physically ready. Bowel training, they start going and having using the toilet. Better control during the day. They start holding the pee. If they want to go to the bathroom, they can hold until they get to the bathroom. And bladder training completes around 3 years. So they have 3 years, they are fully trained. But just remember, everyone is different, everyone varies. So some child will develop before and some will do after 3 years. It's all varies. This is just the generalized average age. Play alongside with other children, but usually play with them. They start playing with other kids, neighbors' kids, and riding bicycles and playing with the parents. Temper tantrum, saying no are common at this age. And, and begin to tolerate separation from primary caregiver, which is who are their parents, or the primary caregivers. See, at this stage, they know, they can feed themselves. You put the food in front of them, they will eat. Preschoolers are thinner, more coordinated, and more grateful than other toddlers. The preschoolers, which is 3 to 5. Increased ability to communicate with others, performing self-care. They are able to, brush their hair, use the toilet, clean themselves, learning, performing self-care, learning gender difference. They know the difference between a boy and a girl. Right and wrong, what is the right thing to do, what is wrong thing to do, learning to play with others, and developing family relationship. They know that this is my sister, this is my brother, this is my grandparents, this is my mom, dad, my uncle, auntie. So they are able to differentiate at that stage. So at 3 years old, become more coordinated. This personal care skill increases, so they are able to wipe themselves off after toilet. They are able to, groom themselves. You give them a comb, they'll brush their own hair. Language increases, so whatever language you speak, they will learn that language. Known that there are 2 sexes, male and female. Now it's 3 sexes now, which is legal now. You cannot call a transgender or a gay person he or she. Has to be like addressed as. So that's in the law now, and we cannot differentiate in the hospital. We just go male, female, other. Then you have to tick. Children may fear from dark, need light in the bedrooms. We all fear dark, so nobody wants to go out in the dark. Less fearful of strangers, and they are try to please their primary caregiver. They'll do things, on their own, try to collect, pick up their clothes, clean up the mess, just to impress their mom or dad. Growth and development, if right now a 3-year-old goes to preschool and they learn. I have a 3-year-old granddaughter who goes to preschool, and now she can even write her own name. So it's strange what the education can do to these guys. The 4-year-old tends to tease, tattle, and tell fibs. Like they'll like to talk, they like to play with you, they'll try to tease you just to get your attention. Yawning is not allowed in the class. Okay. Then you're gonna make me fall asleep too. They play in groups of 2 or 3 and lead to be bossy. They try to control everybody else's behavior. And you probably notice in a child, they want to take the lead. and that's part of the development. Prefer the parents of opposite sex. Like if there's a girl, they like the dad more. And if it's a boy, they go closer to the moms. Privilege of brothers and sisters are seeing, and they are curious about sexuality, how babies are made. They're very curious because to them, everything they're going to learn. Yeah. I tell the growth and the so at the age 5, the coordination increases, communication skill increases. They are responsible and truthful, and like having rules, eager to do the things right way. So there will be certain rules really set up. That's when they start going to kindergarten and grade 1. That's when they learn how to follow the rules. Fears are fewer. They don't get scared of smaller things, like, you know, they are proud for their accomplishment. So that, you know, if they do something good in school, they'll come and show, and then you want to show them encouragement that they are, you know, they did a good. So that also helps with the development. Inmate adults during the play and interest in TV, they like to watch TV. They enjoy doing things with the primary caregiver of the same sex. Younger children are considered nuisance. You guys have any younger siblings? No? Oh, so you probably won't experience that. Okay. Development task in the middle childhood between 6 and 8, they develop social skills. That's when they start going to school, making friends, you know, picking up the sports they want to play, learning to get along with other kids at the same age, learning gender appropriate behaviors and attitude. Like they will know how to behave. This is a boy, how to behave with a girl, and the girl knows how to behave with a boy. Developing considered and morals, like what are the morals, what are the ethics, and developing good feeling and attitude about yourself. Yeah, right now the kids are so spoiled. They like the pizza more than anything else. So often described being bossy, oriented, charming, or accumulative, and know it all. At that, like at the 6th year, they know everything. You ask them not to do something, I know. Okay? We're going to play with children with the same sex, like the boys like to play with the boys and girls like to play with the girls. Have a best friend. And in lately, they say that the childhood friends become your lifelong friends. Yeah, you know, they started the childhood, they go to school together, they go to high school, they go to college, and they become the best friends. Telling and the common is the same. Okay, that play. When they're 7 to 8 years old, they are quieter, less stubborn, and more concerned about well-being of others. So that's when they start developing to make sure that they are not hurting, they're not doing anything about other people. They're worried about their friends' feelings, and you know, and they listen to you if you're gonna say something. Like going to school because that's where their friends are. They like to learn. Peer groups are vital. Like, you know, who they hang around with is very important to them. Well maintained and related well to adults. You know, they communicate with the parents really good. It depends. Like, you know, there's some brats and some are good. So it all depends on individual child. 8-year-old can be defensive, opinionated, practical, and outgoing because their knowledge has increased. So they like to, you know, act like they are adults. I'm just gonna go 1 second. Okay, between 9 and 12, becoming independent of adults and learning to depend on themselves. They like to do things on their own. Developing and keeping friendship with peers, as I mentioned, like, many of the friends the older people have, like older adults, it's their childhood friends, and they become best friends. Developing and keeping friendship, understanding the physical, psychological, and social roles in the gender, the holistic. Remember the holistic approach? Developing moral and ethical behavior, developing greater muscular strength, coordination, and balance, and learning how to study. They make their own way of doing things, like when they want to study, when they want to play, things like that. Girls have a growth spurt. The girls mature faster than the boys. So at between 9 and 12, notice on a female, they're much more mature than the boys are. Both boys and the girls have the more graceful and coordinated body movements. Muscle strength increases. Most of them are believe in the sports. They get stronger. They do like sports, physical activities more. And that's the onset of puberty nears. Puberty is a period when the reproductive organ begins to function, and the secondary sex characters appear. So first thing you probably will notice is when a girl, the hair under the armpit starts to grow, the breast starts to enlarge, and then the pubic hair starts to come, and then they have the menstruation. On the boys, same thing. The armpit hair is the first thing to come out, grow, and then from there they will experience the testes will grow bigger, and they will have ejaculations. What they known as wet dreams. So that's the first sign of maturity. Okay. So between 9 and 12, that's when the real physical changes come in the children. Be a group of certain of activities, like they like to hang out with people who have similar interest, similarity in studying, like if they like the sports together. Children prefer friends of the same sex. Interest in opposite sex begins. So that's when they are developing the adult puberty, and they start liking the opposite sex. And parents and children disagree. Parents are needed for the child's development. So parents has to be there. And most of the time now, like if the parents are not successful, the ministry takes the kids and puts them in a group home where the trained staff are there to look after them. And we've seen lots coming up now. Because I volunteer for the ministry, the abandoned children. So I do volunteer work for them. Adolescents, which is now 12 to 18 years old, they're known as adolescents. In other words, known as teenagers. And that's really when the teenagers they know everything. So adolescence is a time between puberty and adulthood. So they already have the puberty, and then growing up to that's the teenage time. They're going to have the hormonal change, body changes, and different things will appear. Okay. In time of rapid growth, physical, sexual emotions, and social changes. So lots of changes come in this period of time. The most changes occurs mentally, physically, and socially between 12 and 18 years old. There's been lots of changes. The stage begins with the girls reach their puberty between 10 to 14 years of age, because every girl is different. Boys reach their 12 to 16 years old. Okay. Development tasks in adults and accepting changes in the body and appearance. That's the first thing they do. Developing appropriate relationship with male, females at the same group. Some of them start like 16, 17-year-olds. So that's young as 14. I've seen them dating now, walking around holding hands. They develop that for the social and, finding the other side, exploring the gender identity and accepting the role considered normally on one stage and identify a gender. Okay. Become independent from parents and adults. So at some of them at 17, 18, they move out to colleges and they start living on their own. Developing morals, attitude, values needed to function in the society. Increase use of social media, electronic communication devices with peers. So they start, spending more time with the social media to get to explore what's out there and, being on top of the technology. Like when we were growing up, we did not have, so most of the time we were spending is outdoors, playing with other kids. But now most of the kids, they stay in the room and on the laptop and play games and stuff. They very rarely go out. So Macaire marks the first onset of the puberty in girls. It's like having the first menstruation. Okay. So that at that stage, if you're a parent, you want to be teaching your kids about pregnancy and stuff. That age, once they have the menstruation, they can get pregnant, or they can get somebody pregnant. Secondary sex characters appear, like secondary sex characters like enlargement of breast, growing of pubic hair, changing of the voice, it gets deeper. So in boys, the nocturnal emission, like wet dreams occurs. You guys know about these wet dreams, about the boys? Okay, so when they develop into a boy, like the girl, they have the first menstruation. The boys, they have the sperm ejaculate in the middle of the night. And that also creates quite a bit of shame because they're unsure what's happening. So that's called wet dream. They will have a pre-ejaculation, like when they're sleeping in the middle of the night, they'll wake up and then their pants are wet because it has ejaculated. It's known as wet dreams. Okay. Other secondary sex characters appear. The testes gets enlarged, the penis grows bigger, the facial hair starts coming, chest hair starts growing on the chest, and things like that. And then at that stage, that's when they start becoming independent from their primary caregiver, from the parents or whoever the caregiver was. Any questions so far? And we'll take our break at 10 o'clock and then we'll come back at 10:30. Okay? So we'll take half an hour and then we'll finish. And then, there's not much left on this growth and development. So between 12 and 18 years old, still growth spurts occurs, considered awkward stage. When the girls start getting shy, they don't want to wear small skirts. They, because they're not used to this the changes that's coming up. So most of them, they get shy. Physical appearance hard to accept. Concern on the weight because they want to look good until like they're 80 years, 90 years old. They still worry about the weight. Dating begins. Right? That's when they start dating boys, or boys start dating girls. gay, lesbian, bisexual, and transgender youth have same health care needs as heterosexual adults. Now it's legal. Any forms you're gonna fill out in the hospitals if you're doing if you end up in emerge or something when you're doing, it's male, female, or others. Okay, so they have the same right as anybody else. So in teenagers prefer beginning with peers and overdoing things with their families. Adults may begin to feel and show a sexual orientation. Appearance is important. So that's when they spend their time, make sure when they leave the house, they're looking good with makeup, good clothes. You can see high school teenagers, like they really like to make sure they're looking good before they go to school. Adults may begin to feel and show a sexual orientation. Appearance is very important to them. Adolescents begin to think about careers and what to do after high school. That's when they start doing career classes, career coaching. And that I know, this is what I want to do when I grow in the further studies. Teens need to develop moral values, attitude in the living in the society. So that's when this development they come in. Okay. We only okay. Okay, I'm going to stop here for a little bit because we don't have too many slides left. We're going to discuss after the break. We're going to continue. But in the meantime, before you break, I want you guys to go. I have a different book, like end of the chapter, the textbook. There's a whole bunch of key points. Read through that. It will make you understand much better. You guys see this one? Key points. Okay. Let's read through that. Okay. And I'll see you guys at 10:30.
You want us to do the review questions?
No. The key points. Just read through this one. See this? At
What
the
page
end.
is that?
Yeah.
What page is that?
Oh, I have a different book. Mine is 237.
Oh,
Yeah, at chapter 31 we're doing. At the end of before the multiple choice questions, there's a key points. It explains to you all the different development and the what age and everything. Okay?
The chapter review, yeah? Key points.
Key points, yes.
Important development. Okay.
Read through that, that's quite a bit. So that helps you understand. Okay? And I'll see you guys in at 10:30. After you finish reading that, you guys can take your break, okay?
okay.
Eliminate. bowel elimination, and
Uh-huh.
continue, like we're gonna discuss it together in a class. If you can start doing that while we're waiting for Nim.
Okay, okay. So,
Yeah. So,
oh, Nima came.
huh?
Nima joined.
I'm back. I'm here.
Oh, okay.
Yeah.
Okay. Awesome. So, how's the break?
It was good.
Good. That's good. Did you have some congee?
Sorry?
I said, did you eat congee for breakfast?
Koranji? What is that?
That's the Japanese. They make that for Chinese. They make it for breakfast. It's rice pudding with a little bit of chicken in there. Congee. Okay, let's continue. Now that reminds me, I was working with the people that is evacuated from the fire in Kelowna and Yellowknife, and they were placed in Villa Cathay in Chinatown. There's a new facility built by the non-profit Chinese organization, and for lunch for breakfast they were making congee because there's all Chinese in there. These guys were going crazy, and then baked fish, Chinese, soup and noodles. They didn't even know how to eat that. They were really, really starving until they ordered the food for them to come in. Okay, so did you guys finish reading that? Yeah, awesome. So it gives you a little bit of understanding, like different age development. So let's continue with the slide 29. So adults with the teenagers prefer to be with peers over things with their family. So at that age, you probably notice that the teenagers, they like to be more with their friends than the family to build the relationship good with them. Adolescents may begin to feel or show a sexual orientation. So maybe they like a girl in the school or something, and then they try to build a relationship with them. Appearance is important. Adolescents begin to think about careers and what they're going to do in high school. Teens might develop moral and values. That's when they start developing what is the value, what is the moral, what career they're going to choose to go, and that happens between the teenage time. So remember, young adulthood is between 18 and 40 years old. So which category you two fall into?
Young adulthood.
Young adult, good. How about you, Nima?
I think we're same.
Same? Okay, I thought you guys were teenagers.
Really?
Okay, so yeah, most of you guys fall under a young adult. So now you probably know what's happening with the changes, and it's probably reflect yourself in there. Just when we're going through the theory, just keep thinking, have that picture in your mind. Psychosocial and social development continues during young adulthood. Remember when I did the last class, I mentioned the holistic, because you take the three: environmental, psychosocial, social into one and then form. So this is what happening is your psychosocial, your environment, what is happening around you, your social development, like your friends and everything. And then the environmental, like, you're down in DC now in the rainy season, so you're gonna be adapting to that. That's your environmental. There is little fiscal growth. So you already grew in your, like, from 12 to, sorry, I think I skipped one. Yeah. You already grew whatever, like, one individual grows up to their 16 to 17 years old, and then your body stops growing. And the brain cells, you have the same amount of brain cells that you're born with, but depends on your lifestyle, the cells gets damaged, and you're going to have less and less brain cells. The body does not produce new brain cells. That's the only thing you have to remember. Like, lots of people, like, do drugs and smoke and alcohol. Everything damages your brain cells. Once your brain cells are dead, they don't come back. That's the only thing that comes with you when you are born, and until you die. That's why you probably noted nowadays we have severe amount of people with dementia, because the brain cells are dead and body does not reproduce brain cells. Okay, so there's little fiscal growth because you're not going to grow anymore. Choosing an education and career, which you guys just did, that you want to be in healthcare, don't stop here, keep going until you have the PhD. Select a partner. I don't know if you guys have a partner right now, but you're going to be choosy on your partner now because you want to start a family. Learning to live with a partner, becoming a parent and raising children, developing this satisfactory sex life. So I'm going to ask you too. You guys are young adults. Have you ever any of these you guys done, or are you still working on it?
I have husband. I'm married.
Oh, that's good. Any children?
No, no, sir.
How about you, Nima?
No, not at the moment.
Oh, okay. But you're working on it, right?
Yeah, maybe after I finish school and get a job.
Okay, that's good. So between 31 to 36, either one of you are in this category? Young adulthood?
No,
Oh, sorry, I'm just looking at the slide. Sorry.
I'm younger than 36.
Ah,
Nowhere.
that's good. Okay, most adults get married in this age between 18 and 40. Gay and lesbian person may commit to a partner. Partners may learn to live together, and adults need to develop a excuse me. Excuse me, sorry. Couples can plan when they have their children and how many children they can experience an unplanned pregnancy. Parents must agree on a child, practicing discipline methods, adjust the child's life. Like, this is when your life changes from a single person, you become a double, and then you become triple and quadruple, then when you have kids. So this is the stage when you make plans to move forward. Middle age. That's my age. Between 40 and 65. The stage is more stable and comfortable because at this stage you have a good career, you have a good, your life starts planning, you start thinking of your retirement. you start saving for your retirement, and that's when you're gonna meet people who are more into stabilization. They want to establish their life and then think about what they're gonna do after retirement. The stage is more stable and comfortable because you have achieved whatever you wanted in your goal between you know by 40 you have your good career, you have a family, you have everything. So that's when the development started. Like, now you're going to be thinking from 40 onwards for next 25 years what I'm going to do for my retirement. Adjusting to fiscal changes. Yes, you're going to be your body mechanism's going to change, skin is going to change, hair loss, uh, in man, and all these different changes gonna be, and you're gonna learn how to adjust with the physical changes. Because remember, we discussed we were growing up, but now after 40, you're going old. So you're up the hill, and now you're going down the hill. Having grown children, you're gonna have teenagers by then, if you planned it at the right time. Developing leisure time and activities, you're going to plan holidays, you're going to as a couple, because your kids are grown up, they are more on their own life, and that's when the parents, they start planning vacations, they start planning like what they're going to do going forward, leading to perhaps eventually caring for an aging parent. Because you lots of them right now, I noted that like with my career, like I mostly do the assessment for the long-term care, and most of the kids the kids are more involved with their mom or dad, and they're the one who make the decisions for them. And right now I have like the weekend I was in Hope. I have a 92-year-old who's waiting for placement in long-term care, and the daughter is 61, and she's the one who makes the decisions for the mother, to which care home they want to pick and where she wants to go. So eventually, you guys you're gonna be advocating for your parents at that in between the middle adulthood. Okay. Severe, like in this middle adulthood, severe physical changes can occur. There's lots of changes that's gonna occur during 40 to 65. Energy and endurance begin to slow down. You don't have that kind of strength as you did when you were a teenager or young adult. Your body mechanism will begin to slow down. But nowadays, you can see 100-year-old running a marathon. So things are different than what it used to be. Metabolism of physical activities begin to slow down. You guys know what metabolism is? Metabolism is how your food gets digested in your body. It gets broken down, the digestive system. And physical activities, like, it's going to decline. But I've seen, like I have my co-workers who are like in their 50s. They're still going to the gym. Like me, I'm almost 55, and I still go to the gym. I still live my life active. So sometimes it does not. It depends on the individual who how they choose to live. Facial wrinkles and gray hair may appear. Depends if you have hair, but if you go bald like me, you don't have to worry about that gray hair. Wrinkles, the skin starts to losing the subcutaneous layer, and that's when the wrinkles start. The common need of eyeglasses. Yes, we all use eyeglasses for reading glasses. That's when your eyesight starts shrinking. Hearing loss may begin, but it's not. Menopause occurs in women. You guys are familiar with what menopause is? Okay. Many diseases and illness can develop. So it's gonna be like, somebody who has a chronic thyroid or diabetic, hypertension. The things we're gonna come high blood pressure. Where hypertension is high blood pressure. So you're gonna be on a maintenance medication. So you're gonna be taking medications daily or weekly, whatever is prescribed. So what I've been thinking is, after we finish the slide, if you guys want, I'm going to give you some medical terminologies that you guys get familiar with. So it's going to help. It's not a part of your curriculum, but we have lots of time. So I'm going to tell you, teach you guys some medical terminologies that it will be easy for you guys to understand something. If somebody says hysterectomy, you know what it means, right? So I'm going to let you, or if I say, okay, make sure you do it BID, so you know what BID stands for. Okay, that's not part of your curriculum, but we have time today, so I'm going to let you guys know so that you guys get familiar what it means. Hobbies and pastime brings pleasure. Like people go camping at this stage, hobbies, you have what do you call going out with your friends, going camping, whatever your hobbies are, reading, writing. Responsibility of aging parent maybe during this stage. So your parents, like if you plan to take care of your mom and dad, that it's gonna be starting at this age, because when you're 40, your parents probably are 70, 60, 70. So when you get 50, they're probably on the 76, 80. Depends at what stage they plan to have you. Many middle-aged adults deal with death of their parents. And if they are older, you're going to be dealing with the death of your parents. So now comes we call it golden years in medical term, 65 and older. So if you ever had a golden age, that means it's 65 and up. That's a common term used. Adjusting to decreased physical strength and loss of health. I think neither of us are in that age yet. Adjusting to retirement and reduce income. So, we nurses make 10,000 a month. And then once you retire, you're going to get 2,000 a month. So making that adjustment from 10,000 a month to 2,000 a month, like how are you going to manage? Because you have a luxury lifestyle. Once you retire, so you have to make that adjustment. Adjusting to retirement, reduce income, coping with partner's death. Maybe your spouse or your husband is dead when you are 65 and older. You are alone. You don't have a partner anymore. Kids have grown and moved out. They have their own family, and you are all left alone. So you're going to be dealing with this if you ever decide to join the long-term care. This is very important for you to know that 90% of the patients or clients or residents we call are on antidepressant. 90% of them, because guess what? The life they were living in the community is gone. Their partner is gone, and you are confined in one room. Everything is done for you. You lose your dignity. You lose your ability to do stuff, and depression hits. So most of the adults are on antidepressant. Developing new friends, so in the long-term care, if they end up or assisted living, they make new friends. The friends probably they had is gone already. They're probably in another facility or they're dead, preparing for one's own death, which is very difficult for one to think they will start making wills, making changes to their life, because they know that now they are coming closer to their death. So they start preparing, they start making arrangements for the funeral, they start arranging who's going to take care of what at the end of life. That's it. End of our slide. So let's go over, like this one is this. So I will give you guys, say, about 15-20 minutes. How many multiple choice are there? There's 12 questions in the end chapter and review. Just I'll give you 15 minutes to do that, and then we'll discuss it together. Okay. The review questions on this chapter end.
Lima.
So you guys finished?
Yes.
Awesome. Okay. So, I'll read the question, you'll let me know the answer. Changes in psychological and social functioning are called?
Development B.
Development.
Awesome. Okay, which is true of the number two, Pam?
B.
B.
B. Growth and development do not occur in orderly pattern. That's correct. How about you, Nima? 3. The stages of infancy is first.
A. People must successfully complete a task in each stage before moving on to the next.
Awesome. Okay. Number 4. Which reflex in the infant are needed for feeding?
Feeding.
I think I might have the different questions. I think you guys have to read and let me know because I have an old
Oh.
HC book. Okay.
Number 4.
Sorry,
What's
go ahead.
number 4?
Yeah, you read the question because the questions I have is totally different than.
Health is.
Sorry,
No.
can you repeat that? Nima, can you repeat that question again?
Wait, what was number 4?
Yes.
Which reflex?
No.
Okay, you guys.
Maslow's hierarchy of needs can best be described as a system that arranges human needs into categories.
Okay. So you do first, after that you do 2 and then Nima will do 2 because my questions here is different than what you guys have. Okay.
Okay. So question number 5. Which of the following is one of Maslow's hierarchy of needs?
D.
So it's D. Physical needs.
Yeah, awesome. Yeah, physical need has to be met first, which is?
Age of infants is the first 1 year of life. That's number 6, question 6. Which reflects in the infant are needed for the first feeding. B. The rooting and the sucking reflex.
Yes, awesome. Good job. What is your just while we're reviewing? What is the basic needs for one person? Basic needs.
Needs. It's food. It's food, shelter,
Water,
oxygen.
food.
Awesome.
Okay.
So right, yeah, awesome. That's good.
Okay, 5th month to the 7th month is. No, sorry. Solid foods are usually given to an infant during the 5th month to the 7th month.
That's good. Yeah.
The
Question
top
9. Yeah. The toddler can name parts of the body.
No, use a spoon and
No.
cup. The toddler can use a spoon
Use
and
a spoon and cup. Okay.
yeah.
That's
Number
good.
10. Number 10. Playing with other children begins during
C. The
the
preschool.
preschool years.
That's good. Okay.
Number 11. Peer group activities become more important at the age of 10 to 12 years.
Yep. That's it.
Yeah, Nima, you can.
Or is it my turn?
Yeah, you can continue.
Are we on question 13?
Yes.
The following is true. B. Most girls reach puberty between the age of 10 and 14. 14 is dating, usually begins within a crowd dating.
That's good.
Yeah.
It's your turn.
Question 15. Adolescent is usually a time when parents and children disagree.
Okay. Sounds good.
And number 16. Which of the following is the developmental task of a young adult? Choosing an occupation.
Mm-hmm.
Okay. Number 17 is middle adulthood occurs at about the 40 to 64, 65.
40 to 65, yes.
Middle adulthood is usually a time when children have grown up and left home.
Mm-hmm. Yeah.
Yeah, we're done with the questions.
Okay. So now let's for your homework, you guys do the workbook on this one, and we'll discuss it tomorrow morning. And
Okay.
right now, let's review the bowel elimination.
I don't think she did it.
Now we'll do it together.
Okay.
Yeah, we'll do it. I'll read the questions and the true and false, and you guys let me know it's true or false. Okay.
Okay.
Okay. So whenever you're ready, let me know. Okay, the feces move through the intestine by a process called defecation.
Wait.
Do you have your workbook, pen? Okay. Yeah, you
Yeah.
can.
You right?
You ready, Nima?
F.
False, yes.
False.
What is the process called that moving of the is called peristalsis. So it just goes from one, it's like a balloon going down. It's called peristalsis. Okay. Constipation is a condition in which the bowel movement is less frequent than usual.
True.
True.
Yes,
That's
true.
good. And what you can do in the natural way to help with constipation, increase fluid.
Yeah, drinking.
Increase fluid. Okay. Liquid feces sipping from the anus is not a sign of fecal infection.
Which question is that?
3.
Oh, I
Support
guess
workers
I
are
have to-
not responsible for the promotion of normal bowel routine for clients. That's number.
Yeah, no, yeah, I think that's why because they gave me a book. This is about 2 years old.
Oh, okay.
So the question, they don't have any new ones. So I mean, I'm just going whatever I have. So yeah, that's false because sometimes sipping of the water fluid and the anus could be indication of fecal infection. Okay, so if there's a fluid coming out and just clear liquid, that could be a indication that there's a fecal infection in there. Okay. Okay, what is your number 3 question? Sorry, Nima, I don't have that.
Support workers are not responsible for the promotion of normal bowel routine for clients. That's false.
Okay.
And then fewer than 10 wet diapers per day from an infant may indicate dehydration. False.
False, yes. Okay, okay, I have those questions there. Enema can be dangerous.
True.
True, yeah. As I mentioned, it can, put the person into hypervolemic shock. Okay. A support worker is allowed to insert rectal tubes to relieve fluctuance.
False.
False. That is, even the nurses are not allowed. It is a procedure that's done in hospitals.
Okay.
A stoma is painful when touched.
False.
True. False. Yes, you're right.
It's false or true?
False.
False.
Yeah, maybe when it's freshly done, might be painful, but other than that, there's no pain. A client with an ostomy pouch can wear normal clothes.
True.
True, that's good because You don't see that. It's gonna be hidden underneath your clothes. When internal bleeding is suspected, feces are checked for blood.
True.
True. What is that called? Start with M.
When they check for the blood?
Yeah, when you look at it's known as normal thing is known as terry stool, which is black and melana, presence of blood. So as I mentioned yesterday, if it's upper GI bleed, the stool will be black and terry. If it's lower GI bleed, you will see the blood on the stool. So it's gonna be either bright pink, that means it's hemorrhoid. If it's like little dark, it could be from the sigmoid column. But if it's bright red, let the nurse know, and then they can order some hemorrhoid creams. Okay. A commercial enema stimulates distends the rectum.
True.
True. Yeah. So that's what it does. Is like you push the fluid in, it expands the colon, and all the stool that's impacted in there just comes out. Okay. Feces become hard and dry when the fluid intake is poor. True, yeah. Because you need lots of fluid in order to keep if it's hard, like, the nuggets coming out, that means the patient is dehydrated. Okay. The support worker may help to prevent fecal incontinence by responding to all requests for help using the bathroom, toilet pen, and commode.
True.
True. Yeah. If the patient asks you, I want to go to the bathroom, put them on the toilet or put them on the commode. Try minimum to use the bedpan because it's very uncomfortable. One or two goals of bowel training is to develop regular bowel pattern elimination. This preventing fecal impaction, constipation, and fecal incontinence.
True.
True. That's good. Yeah. And how you train the bowel training? Remember we mentioned yesterday is let the first person defecate and then let them hold it for 2 seconds, 3 seconds, and then let it go again and hold it again. Exercising the muscles on in your anus area. Okay. And what is the training that you're gonna do with the urinary incontinence? Start with K. I mentioned yesterday. With exercise. Kegel. Yeah. Let them void and stop. Void. Stop. Void. This helps the muscle to regenerate and then help with you. Okay. When you are helping a client with the bowel training, the client is usually encouraged to use the toilet commode or bedpan before meal. Balls, yeah. Because before meal, the peristalsis doesn't start. So lots of the client, when they start eating, your digestive system gets active, and then you put them on the toilet and they will go. Okay. A suppository is used to stimulate defecate when bowel training is being done. When you're doing the bowel training, yes, if they haven't gone for so many days and you want to retrain, yes, sometimes you have to give them suppository so it stimulates the stool to come out. Okay. Giving an enema is delegated task. What do you think? I mentioned this yesterday.
True.
Yes, you don't do it. It's done by a nursing professional or the doctors. Remember what cranial nerve you can stimulate if you do go too deep in the rectum, and what can happen? C10. Like if you go too deep inside the rectum with your digital your finger, you can stimulate cranial nerve 10, which can stop the heart.
Yeah.
Yeah, remember that I mentioned, yeah. So try not to do it. The most you can go is like the second
You actually
line.
have to put your finger in there to get the poop out.
Yeah, but only thing you want to go is your second finger, like this line here. That's the how deep you want to go. If it's you need to put your full finger, get a nurse to do it. Okay, you can go up to your 2 fingers. You know, if they most likely you don't have to go that deep. If there's a fecal infection, remember I said you can digitally remove it, and you can just go up to your second line. Because everybody has some. I have a short finger. Some people have long finger. So always keep in mind the second line on your finger. That's how deep you want to go. Commercial stimulate distend the enema. That's true. The only saline enema may be given to children.
What question are you on?
I might have the 18.
The volume level?
Oh no, I don't have that one.
Different question.
Okay, can you read the question and then we'll go. Okay, you guys have the purpose of ostomy pouch is to collect feces and flatulence.
No.
Yes, it's true.
19. Yeah.
19, that's right?
Yeah.
Yeah, so the purpose of ostomy pouch is to collect feces. Yes, it's true. And flatulence, the gas that's going to come out. An ostomy pouch can be removed and changed when peristalsis is less active. The best time usually after breakfast. We had false, yeah. You change it when there's full of feces. Okay. Now, as I mentioned, like in the book, it says that you can, leave it and drain the. But now the new protocol for the infection control is once you remove the bag, it goes in the garbage and you put a new bag. We do not drain the bag anymore. Yeah, that's the new protocol for health authorities because it believed that the infection starts when we drain and put the bag again to reuse, and the bacteria can build up and end up in GI system. So now the protocol is once you remove the bag, it goes in the garbage. Same thing with the catheter bags. We don't change it anymore from like we used to do in past, like from a day bag to night bag, because day bag was only 500 ml and the night bag is 2 liters, 2000 ml. But now it's on the bath day, you just take it out and throw in the garbage, put a new one in. So we don't interchange it anymore. We used to change it as maybe in the home support setting, you might see it. They wash it with vinegar and water and they reuse it at night and day. But in the facilities, it's changed on the bath day, which is once a week, and then it goes in the garbage. The ostomy pouch can be removed. Oh, no, we've done that. Feces from the ileostomy is especially irritating the skin because a small intestine contains adhesive juice that can be irritating. Ileostomy, remember I mentioned? It's gonna be like water, and it has lots of enzyme in there. And if you don't do a proper care, it is gonna irritate the skin because it is very high in pH alkaline. Okay, and so always do a really good skin care. Ileostomy is the removal of the whole colon, the large intestine, and then the small intestine. They put a stoma on it, so when the waste comes out, it comes out, and it's very watery. Awkward blood is a bright red blood that can be observed in the stool. What do you think?
False.
False. Don't say that. That's when you suspect a bleeding and awkward blood. That's when you collect the stool sample and then send to the lab. Remember those, there will be a little card, and then you're gonna take the smear it. One is 3 bowel movement, and right after that you put in the fridge, and then once you collected all 3 samples, you're gonna be sending it to the lab. That's called occult blood test, OB. Okay. What are the some signs and symptoms of fecal infection?
B, C, D, E, F.
Yeah.
No, wait. What question are you on?
25. What are the signs and symptoms of fecal infection? It's A is abdominal discomfort and swelling. That's true. Cramping. That's also feeling fullness and pain in the rectum. It's very rare, but it could be. Nausea and vomiting is another one. Increased need of decreased ability to urinate, because that's different system. And then H, regular bowel movement, that's not correct. Liquid feces sipping out of the anus. Remember we discussed that? That could be a sign because the solid is all impacted and is blocked from coming out.
What about fever?
No, there won't be any fever. No. Fever is sign of infection. You're gonna feel, the patient will say, I feel bloated. The abdomen, when you palpate it, it's gonna feel hard. They're gonna be having nausea and vomiting. These are the signs of fecal infections. So what are some of the common causes of constipation?
Mm.
So it's B, ignoring the urge to defecate. Defecate means to, when you want to go to the toilet, you don't want to go.
Okay.
Right? And it happens to us when we're going for a long drive, and then we really want to go, but the toilets on the on the park are like all pit toilets things, so you don't want to go, and then guess what? You get constipated. You stop, and then it becomes dry, and then it's hard to pass the stool. Decreased fluid intake is one of the other reason. Medications, yeah. Which medications cause constipation? Some of the medications I mentioned yesterday: Tylenol, Tylenol 3, morphine, hydromorph, methadone, Suboxone, any medication that's given for pain. You take it orally, not topical. Like if you apply on the skin, it doesn't bother. But if you're taking it orally, because it slows your peristalsis and slows your metabolism. Okay, aging is another one. And certain disease also causes constipation, like colon cancer. Sorry?
Not D.
Huh?
D is not one of them.
No, activity will reduce constipation. Remember, if they are exercising, it will reduce constipation. It won't cause constipation. Okay. What should you observe and report when the client has a bowel movement?
27 is which of the following? Comfort and safety.
Nima, I think it's 24.
24.
What should you observe and report when a client has a bowel movement?
You don't have
You can check question number 24, Nima.
What you guys were doing 25 though. So confused.
Yes, but I think the sequence is different from teachers.
Yeah, my sequence is different.
Okay. Number 24 is A, B, C, D, E, F, G, H.
Yeah, report anything that's unusual. Good. Okay, so 20, I think yours is 27. Which of the following comfort and safety measures can the support worker use when assisting client with fecal elimination?
A, B, D, F, H, J. I.
Make the bed pen is position the coin the left side position. Yeah, when you're giving enema, make sure that your client is on the left side in a semi, and then the knees are a little bit deflect so it aligns the colon to the anus to pass. That's good. Although the defecation, do not rush the client. Yes. Call bell in the toilet. Yes. Leave the room. Yeah. Provide them privacy. Give them some. Provide oral care. No, it's nothing to do with the. Yeah, dispose this because they're gonna if they're incontinent. Make sure you don't put the whole incontinent pad. We don't use the word diaper for adult. That's for babies. We use either incontinent pads. Okay, in the toilet, the proper way of food. What symptoms may occur if flatulence is not relieved? You know what flatulence is, right?
Yes. A, abdominal cramping or pain. B, shortness of breath. C, swollen abdomen or bloating.
Yes. Flatulence is in common term fart. Flatulence is a medical term for fart, somebody farting. Which of the following is the reason the enema is given? First A, to remove feces, yes. To reveal constipation or fecal impaction. To clean bowel and feces before certain surgeries, yes. D. And then E. So C is not encourage weight loss, but no, lots of people are taking enema now, younger generations, to lose weight. But that's not the answer for this question. How can an odor associate with ostomy to be prevented?
A.
Good hygiene? Nah, that's not like how are you going to prevent odor? Good
C.
hygiene, yes. By emptying the bag pouch.
It's A, C, D.
Yeah.
What's it?
No, B.
Instructing the client to cover it with the plastic bag.
Is
You
it
don't do D. You don't put deodorants in the pouch.
Oh,
Okay, so you either provide good hygiene, that's good, because then the all the feces are by emptying the pouch when it is leaking. Okay, good. So how about Pam, you're gonna read the 31 and then we'll discuss it. Which of the following will not assist the fecal elimination?
B, using a bite.
Yeah, and there's another. Okay. Which of this food would most likely stimulate fecal elimination?
B, whole grain cereals.
Yes. Yeah, whole grain promotes. But remember, I mentioned people with diabetes colitis. You don't give them a whole wheat, anything that's containing fiber. Then you have a big mess to clean up. Even don't give them any milk, any kind of dairy product as well.
Oh,
How about nuts?
Nuts is okay. Nuts is okay. It's like brown bread, brown cereal, dairy product.
Almonds.
Yeah, don't give them because they already have diarrhea, and you're gonna promote in getting them diarrhea. Mr. Lane, 85, usually has a bowel movement after breakfast, about 45 minutes after having bowel movement. He wants to go to the bathroom again. The most likely reason for this is?
C.
Yeah. So in older adults, remember, part of the aging process, they lose the elasticity and the peristalsis decline as well. So once the peristalsis decline, they are not able to empty the rectum fully. Okay. So that's why if you're taking somebody to the washroom, let them sit there for at least half an hour, especially older adults. Which of these may kill a normal flora in the intestine? You know, I mentioned yesterday. Hello. Sorry, 1 second. Remember, I mentioned this yesterday that when somebody is prescribed antibiotics, it does not kill the bad bacteria. It also kills the normal flora. And that's something you want to do if somebody's on antibiotic. You want to hold off any kind of dairy product because it will the normal flora is killed as well. So they will have constant diarrhea. Okay, so antibiotics is the right answer for 34. What instruction will the nurse likely give you? A client has diarrhea.
We give the client plenty to drink.
Awesome. And they might give you the sheet to put INO, intake and output. So you're going to be recording like how much 1 gram of stool. So if somebody is incontinent, you're going to weigh that the incontinent pad. 1 gram is equal to 1 ml of fluid. So if you weigh the pad is 500 grams, so that means the output is 500 ml. So you're going to write on that intake and output sheet, and depends on the size of the glass they use, they'll let you know. Like it's 180 ml, 240. So you write down how much fluid they're taking and how much output is. So that will probably get you when somebody's having a diarrhea to make sure they don't get dehydrated. What is the risk of somebody having dehydration?
Sorry?
If somebody gets dehydrated and they're having constant diarrhea,
Uh-huh.
what is the risk? Going to hypovolemic shock.
Oh.
Hypo means low, and they can die from it. The blood pressure will go down, the heart rate will go down, and they can die from it. So it's very important to do the INO when somebody is having diarrhea, especially when they get infection of C. diff. So yeah, and then okay. What instruction will the nest? What would an effective nesting action to be to relieve flatulence? And flatulence is
C.
Medical term for fat. Oh, so
yeah.
making sure the diet is high in vegetables.
Yeah, because vegetables, especially if you're having cabbage, asparagus, they will increase flatulence.
So is the answer D or is it B?
Both, D and B, both.
Oh.
Yeah, absorbing implies of placing the client in the sideline position. Place them on this left side, and that will relieve the flatulence. And then changing, like not giving them too much cabbage, broccolis, asparagus.
Okay.
Those things promote flatulence. Okay.
So is it like it, like it can cause gastritis as well? Like
No,
asparagus and all?
no, gastritis is caused by acid.
Oh.
Yeah, what it does is the acid, because when you don't eat on time, there's hydrochloric acid in our stomach, and it's that one of the digestive juices that digest the food. And if there's nothing in there, we have the endometrium, which is the first layer align in your stomach, and then the acid start chewing on that, biting on it. So the first layer endometrium gets damaged, and that's what gastritis and ulcer is. And then we have what do you call that? That's just off my mind. There's a Doppler that stops when you from back reflex, and sometimes when you're laying down flat, this one opens up, and then the gastric juice comes up. That's when you get gastritis. So it's nothing to do with the flexions. It's the acid in your stomach. Okay.
Thank you.
When the nurse inserts a suppository to stimulate defecation, how soon would you expect the results?
In about 30 minutes.
In about 30 minutes. Sometimes you do it immediately. Sometimes next morning. All depends on individual and the medical condition and their ADLs. Like if they are bedridden, they don't have any activities, then you expect it to maybe take longer. But if somebody is active, walking around, sometimes 30 minutes. Sometimes if you put the suppository, 10 minutes later, you're going to have the results. So it's all varies. But the correct answer is yes, in 30 minutes for your exam purposes. That's it. One more page. How much solution is usually given to an adult as the cleaning enema? I mentioned this yesterday. One enema is 500 ml.
Wait,
Which question is it?
Is question 38.
it is a
500 to 1000 ml. Yes. It depends. Sometimes if a person is obese, like they have a 500 pounds, 400 pounds, and they have a huge body, then you might have to give them 2 enemas in order to properly walk. But for normally we use 1 enema, which is pre-filled already, and it's 500 ml. Okay.
Okay.
It depends on the person. Like some elderly are very skinny, and you don't want to give them the full enema. You will give 200-300 ml and then stop. So remember I mentioned yesterday, when you're giving somebody enema, it's not done by the RCAs, it's done by the nurses. But if you end up in a home support, you might have to do it. But you insert the enema, you squeeze, and then you hold it, keep holding it, then pull it out, then release the pressure. But if you release the pressure while it's still inserted, the whole enema will come back in the bottle. So you put there's a tube which is about 5 ml. You insert it inside with the lube, and then it's pressed. The fluid will go in, and then while pressing on it, you pull it out, then let it go. But if you still have it inserted and then you let it go, all the fluid that you pumped in will come back in the bottle. Okay.
Okay.
Which position is the best when giving enemas?
Semi-follows position.
No. Semi-follows is like
No,
sit
no.
45 degrees on the bed.
Yeah.
Follows is straight. Semi is, so that's not
Right position.
prone position. Prone position, yeah.
Front position.
You know what a prone position is?
No.
Okay. So the prone position is they have the elbows on the bed, the buttocks raised, and on the knees. So that's prone position. But most of the time we give enema, we lie them on the left side. And then bring the knees up, exposing the rectum, and then we do it like that. When giving enema, what should you do if the client complains of abdominal cramping?
question are you on?
40. So normally you're not gonna give enemas anyway, so I'm not gonna go too much on that.
Mhm.
Yeah, it's either done by the doctor or the nurse on duty. Suppositories, yes, you guys could be doing the subs, but not the enemas. Enemas are done by the trained nurses. But yeah, so it's when somebody complains of cramping, you pull it back maybe 1 or 2 centimeter, because some people, remember, they're fatigued, and if you push it all the way, there's not enough room to for the fluid to go. So just pull it back and then do it. But I'm not too worried about you guys knowing this, because unless you become a nurse afterwards, then you're going to be trained how to do that.
Okay.
What is the purpose of rectal tubing?
Relief of constipation.
Awesome, that's good. Yeah, and it's done in the hospitals. It's not done at home or in the long-term care. Okay. And they're mostly done by the doctors. So even the nurses are not allowed to do the rectal tubing. What is the constituency of stool if colostomy is near the end of the large intestine? Remember I mentioned yesterday, like the stool will be different and each where the ostomy, the opening is. Remember we have ascending, transverse, and descending. So on the left side, no, right side is ascending, and then it goes over transverse, and then it's descending. So this so imagine just before the sigmoid column ascending, descending, where the stool comes out. How do you think the stool would be formed? Yes. And if it's on the right side, right by the appendix, it's going to be loose, because the water gets reabsorbed when it goes through the stool, goes through the colon. So when it comes out from the small intestine, it is watery.
Oh.
Yeah. And then slowly all the enzymes get reabsorbed by the body. And then when the stool comes on the descending, then it gets hard, like formed. But if it's on this side, opposite side, then it's going to be runny. And if you have like on the transverse, if you have double ileostomy, then it's going to be sometimes runny, sometimes formed. All varies. You should wear goggles when testing a stool for OB. Yeah, prevent contact with the body fluids and absence. Remember that when you're testing the stool, in 1 ml of stool diluted is 1 trillion bacteria. So yeah, the most dangerous one that can splash on your eye is E. coli. And E. coli is very contagious. Right? So just be careful, because eye, ears, mouth, nose, anus, vagina are the entry for the bacteria to get in your body. So, or the tip of, you have to protect yourself first before you can protect others. Always keep that in mind. Okay. So the matching one, have you guys done that? Bleeding in the stomach. What do you think it is? It's gonna be
Stomach.
black, yeah, because it's upper GI. Remember the GI system? Upper GI consists of stomach, gallbladder, and then lower GI is your sigmoid, your colon, and your hemorrhoids and stuff. They are lower GI. Bleeding in the lower colon or rectum also beats is red. Yes, it's gonna be bright red or pink. I have diet high in green vegetables.
Green.
Yeah, good. Semi-solid mass of waste products in the colon. Semi-solid, formed, right? is known as physis. Introduction of fluid into the rectum and the lower colon. We just talked about it. Enema. You're putting fluid in to make the colon bigger and letting the stool just flow out. Artificial opening the ileum and abdomen is known as ostomy. We just discussed that. Okay. Any the opening is known as stoma, but ostomy is where the stool is gonna come out from. Bowel movement is known as defecation. You defecate.
So what's the answer for question 50? I couldn't catch.
Sorry?
What's the answer for question number 50?
Artificial opening between the ileum and abdomen is known as ostomy.
Okay, thank you.
Yeah. Alternative construction and relaxation of interstitial muscles are known as. Remember I said, how does the stool move? It's known as peristalsis. It's a process when of moving of fecal in your stomach or colon. Sorry, not the stomach, colon. A cone-shaped medication that is inserted in the body. Mr. Sup. Suppository. And there's two types. There's Biscotti suppository and glycerin. It depends on what kind, like the condition. The glycerin is much better than Biscotti. Biscotti is given when you feel you do the rectal check and you feel really hard, then you give Biscotti. But if it's impacted, it feels soft, then you give glycerin. Biscotti is for more of a really hard stool. Gas or air in the stomach or intestine is known as fluctuous or fluctuans. Fluctuans is when you pass. The gas in the medical term is known as fluctuous. Okay. What is diaphoresis? You guys know? If I say patient is having diaphoresis, diaphoretic, that means the person is sweating a lot. Sweat in medical term is known as diaphoresis. Okay. A frequent passage of liquid stool is when you're having a loose diarrhea. Oh, sorry, I said the answer is diarrhea, loose stool. Potentially a partially digested food and fluid that pass through the stomach to the small intestine is known as, the enzyme is known as chyme, H. So when the food gets digested in your stomach, it becomes a chyme, it becomes liquid. And that's where the lots and lots of enzyme is. And that's why, like, if somebody has a ileostomy, you have to do a really, really, really good skin care with around the stoma, because it is pH is so low that it can, pH is so high because of the enzyme, it can cause big time irritation in skin. The opening in the colostomy and ileostomy is ileostomy. Anytime you see ostomy, like the word tomy, that means it's opening. Anytime at the end of a medical term, you see ostomy, that means there's an opening. Ileostomy, go to cardiostomy, that means they have a catheter in the heart, especially if we have patients that they always have a chronic problem of getting sepsis to the heart. They will have a in the medical, they call it protocol. That means they have a catheter that goes straight to the heart. People receiving chemotherapy, they have that because chemo, if they're having chemotherapy, it will damage the normal veins. So anytime you see ostomy, that means it's opening in the body artificially. Okay, we done this. So that I'm gonna let you guys know some medical terms. Like as I mentioned yesterday, anytime you see a starting of a hema means blood. Hematology, hematitis, that means it's presence of blood. If you see ITIS, that means inflammation, arthritis, cardiacitis, osteoarthritis, means there's an inflammation, there's infection. Any word medically ending with actomy, ACTOMY, that means removal of an organ. So if you see like hysterectomy, for example, the removal of the uterus, colonectomy, that means removal of the part of the colon, appendioectomy, that means removal of the appendix. So ectomy means that organ has been removed from the body. Hema, what else I can see? So this just the it help you understanding the medical terminologies. So if you have a nurse, they will give you a cream, tropical cream for dermatitis, right? Dermatitis, dermo means skin. Titis is inflammation of the skin. And mostly in common term, we call it diaper rash. And elderly who are incontinent and they wear the incontinent pad, they most likely they get around the buttocks area. It's a red rashes because of the urine being concentrated or stool, like they're having diarrhea. So they will say, okay, apply the Betadine cream, BID. What does BID mean to you? You don't know. Okay. So write this down. I'm gonna give you, if a nurse says OD, that means you do it once a day. Write this down because it's not in your program, like in your program. This is some extra I'm letting guys know. If I say, okay, OD, OD means once a day. Yeah. If I go BID, means twice a day.
BIB.
BID, yeah. Means you apply twice a day.
Twice a day.
Yeah. Even the medication, like sometimes they say, okay, because you don't have to know how the prescription works, but PO means by mouth. PO.
Oh.
Means if somebody puts a PO, that means you give them by mouth. PR is birectal, perectal. Okay. If I go tropical, that means you apply on the surface of the skin. If I go SL, you go sublingual. You're gonna put a medication in the mouth, under the tongue, and mostly it is Ativan. If you have somebody having seizure, the protocol, if somebody is having seizure, if it continues more than 2 minutes, you give them sublingual, and if it continues more than 5 minutes, you give them Ativan injection. And if it goes more than that, 100% of the time, they're not gonna make it. You call 911 and then sublingual. GTT means drop, eye drops.
Sorry?
GTT means drops.
GTT.
Yeah.
Eye
drops, like GTT, how many drops? They say 2 drops in each eye. They'll go 2 GTT once a day, twice a day. TID, 3 times a day. If the nurse says, okay, apply 3 TID, that means 3 times a day. If I go QID means 4 times a day. Okay, if I go HS, means bedtime.
Sorry?
HS means bedtime.
Bedtime.
You apply those medication at bedtime.
Okay.
Okay. If I do Q1D, that means every other day. If I go to Q2D, that means every 2 days. If I go Q1M, that means once a month. Okay. QW means once a week.
Mm.
Okay. What else I can think of? Yeah. Yeah. So these are the more will apply with the medication. They'll give you, okay, do it TID. That means 3 times a day. So within 20, you do it morning, afternoon, and bedtime. QID 4 times a day. So you divide 24 hours in divide by 4 is every 6 hours. Okay. So these are just for your knowledge, like, it's good to know. Ectomy, inflammation, anything, and with ETR, that's the removal. What else I can think of? Yeah. Let me see if I can find the one evolves. Terminology that I can share with you guys. Can you guys see my screen?
Yes, sir.
So these are different systems of our body um, that you guys need to know. Like integumentary system is skin. Anything to do with your skin is integumentary system. Skeletal is all the bones in our body.
Yep.
Muscular is muscle. Nervous system.
Nerves.
Yeah, with the nerves and your peripheral nervous system, central nervous system, your sense, your urinary system, circulatory system, which deals with heart, lungs, and blood. Lymphatic system is the one that does the lymphatic as the system that prevents the infection, and that's more complex. Like you have in your groin, you have two, and then underneath your armpit. If you have like you won't feel it if you touch it now, you won't feel it, but if you have a major infection, that will swell up. And it is a lymphatic system is the one that prevents your body from severe infection, respiratory, digestive, and reproductive. So let's right, since we've done the bowel, that's the digestive system. So this is our the digestive system. The digestion starts from as soon as you start chewing the food, it starts. The saliva is one of the digestive juice. It gets down to your stomach, and the stomach have hydrochloric acid, which starts breaking the food down into a chyme. Remember you were asking about the heartburn?
Mm.
Yeah, this is where there's a valve here that prevents the juice from going up. But sometimes when you sleep, this thing opens up with the and then the hydrochloric acid flows in here, and that's when you get the burning. Our system, like our any layer inside your any organ has three layers. The first one is known as endometrium, and the outside is visceral layer. So endometrium, they are the ones that are very strong to prevent any kind of damage to the organ. Lungs has the same thing. They have three layers of skin. Endometrium and then visceral. Okay? Visceral is outside, and endometrium is known as inside. So the food travels. It comes down, goes inside your small intestine, and the digestive juice go. All the nutrients start getting absorbed. If you take your small intestine, it's coiled up. It's one of the longest organ. You can put it across around a tennis court. That's how long it is.
Oh.
Yeah, but it's coiled up. So when the food, the chyme leaves goes inside the stomach, can you imagine how long it is? It's taking out, absorbing all the nutrients. That's where it gets, and then it comes out into your large intestine. It dumps it in there, colon, and then the stool starts going. This is the ascending. This part, and this is where appendix is. So the food, when it enters here, is liquid, and then another reabsorption takes place when it comes inside the inside your stomach, like colon, and then slowly the fluid gets absorbed, and then this is known as transverse, right? And then this is your descending. So by the time the stool gets here, about 90% of the water fluid is absorbed back in body, and then your feces come down here. This is down here is known as sigmoid column, and then you defecate. Okay. So yeah. So this is where your stool comes out. Okay. Just a little. Just one second. So this is how our colon looks if you cut it open. These are your kidneys. And this is how the lining are endometrium and visceral. And they keep, the fluid comes, they get reabsorbed. It's like a little tubings inside it. Okay. So this is the cross section. You don't need to know this. It's just the extra knowledge for you.
Sir, are you working as a healthcare assistant in one of the hospital?
No, I'm a nurse.
Oh, okay.
I'm a nurse with Fraser Health. I'm with the regional deployment team. I go mostly, I used to work in long-term care and hospital before. And about 3 years ago, I joined this regional deployment. I go, I'll do assessment, prepare the care plan for people who want to be placed in long-term care.
Oh,
Yeah, so mostly I do that, and so that when they go to the long-term care, they know what kind of care they need. So yeah, I work mostly 7 to 3, but the only thing is my days off changes. I go all the way from North Burnaby to Hope.
So, like, if you want to become nurse, then like, can we take some course and then apply for nurses?
Oh, yeah. Once you become a RCA, you do 2,000 hours of RCA, and then you enter the bridge program. You don't have to do the whole program. Then you can go to the bridge program, and it's a little shorter, and then you can become LPN.
Oh,
Then you become LPN. Instead of doing 18 months, you only be doing, I think, 12 or 13 months because you already done the HCA part. When you become an LPN, you work, I think, 2,900 hours as an LPN. Then you can bridge to RN, diploma, or RPN, psychiatric nurse. And then once you become there, you can do, I think it was 4,000 hours as a under diploma program. And then you can do a BSN in nursing. You can, and then when you have done BSN, you can become a nurse practitioner. You can become nurse practitioner. Once you do a PhD, you're going to be equivalent to a doctor.
but I don't have science background. Is it okay?
You can take you can take like work, but you can take down at the adult learning center. I don't know which city you live in.
Sorry,
Which city you live in?
right now
Yeah,
in Vancouver.
or Vancouver. So there's one in New Westminster. It's called PSN Adult Learning Center. And you can do your biology and your English. You get it done because you need English 12. So while you're working as RCA, get this two done on your own because it's just on your own time, and it's government funded, so you don't have to pay for it. So it doesn't mean that you have to be in the classroom. There's certain things. Once you've done that, you submit the exams, do the assignments, and the teacher will mark it online and send it back to you. You have 3 attempts to improve your mark, and you can do it that way. The first, they will call you in to do an assessment that what level you can do it, and then just keep doing that, and then yeah, and then you get your English 12. Once you get your English 12, you don't need to do ISL anything, and then you can do biology 12, which is mandatory, and then you can start your biology. They'll say, okay, they'll give you an exam, and they will assess, oh, you are at biology 10 level. Then you do biology 10, then you biology 11, then biology 12. And chemistry, you need up to grade 10 chemistry.
Oh, So like my actual course I will be starting this January in UCW. It's like, is it possible to do it along with my
Yeah, because you're gonna be
course
doing,
and this
yeah,
nursing course?
yeah, because you're gonna be doing on your own pace, own time.
Oh, like is it like on learning online or
Yeah.
something like that?
Online, and then to write the exam, you book an appointment and
Oh,
go in school to write the exam.
that's good.
Yeah, so it is like you do it on your own pace.
Okay.
Like I
So
did.
like they provide us a certificate?
Yeah, they will. Once you get the certificate, it's yours for life. Because I had my English from my back home.
Okay.
I had biology 12, I had chemistry 12, everything. But the Canadian schools, they were not recognizing my English because it's from a different country. So that's what I did. I went and I did English 12 here, and before I could get admission in the school. And so I did it on my own pace. Like they will, you'll get the materials. Like first you write a essay composition, and then
Okay.
you submit it. The teacher will mark it, and then you do short stories. That's a part of English 12. You do the short stories, and then you go in school, in class, and you do the exam that you are understanding, and then they will give you play like Shakespeare play. I did Hamlet, and then once you've done that, then they'll give you once you've done that test, you go in school, and they'll give you a multiple choice
Okay.
based on Hamlet, like and then last they give you grammar. So
Oh,
you go, and then once you have the certificate, and that's for life. Then if you ever want to attend like anywhere high education, you don't need to redo English.
oh,
Yeah, but biology and chemistry, because I challenged it, and I got really good marks. But my English,
okay.
I had to redo because they were not recognizing the English. Yeah, so that's why. Yeah, but you can do it on your own pace, and I would highly suggest, because it's government, and you don't
Oh,
have to pay for it. It's the BC government, like school board. They do it. I
oh,
find out in Vancouver. I don't know where in Vancouver it is, but now I moved to Maple Ridge. But I did mine at the newest, where the New Westminster High School is, right attached to that.
oh,
Yeah, you can go in the evening if you need to. If you don't understand something, you can book a. Let the teachers know. There's always somebody from 8 a.m. to 10 p.m. There's two teachers, and then you can, if you don't understand something, you can go and ask them, and they will explain it to you better before you write the exams.
okay.
Yeah.
So I think I should ask help from you, like guidance, if I ever happen to, like.
I charge $100 an hour, so
Like working in the hospital, how is it like? Like, do you enjoy?
I
How the wage rate and everything?
like at the beginning when you're young, like it is challenging, and it is like you learn your skills really fast because every day is different. Long-term care for the nurses is the easiest thing. All you do is do medication, do your assessment and everything. But hospital, you're doing everything. You're doing giving the medication, you're doing the personal care, you're dealing with the doctors, you're booking the appointment. Daytime, you have what do you call office assistant, but if you're working night shift, you're doing everything on your own. And it's very fast paced. And then during COVID, it was crazy. Like, we would do like 10 patients a day, where we are only supposed to be doing 5, where we double the workload and working long hours. So yeah, if you need any kind of guidance, just even I'm not on here class, I'm working. Ask me anything. I'm here to help you guys.
Mhm.
Yeah. So yeah, but don't stop education. Keep going. Keep going.
Yeah, I think so. But I'm not sure whether I can do it or not. Science thing is really hard, difficult.
No, no. Science.
That we don't give medication and if we work at a hospital.
For the RCS, no. You are just assisting with the like, nurses that they're like, if somebody is total care, they will ask your assistance. You're gonna do like some shower, bath, changing the pads and stuff like that. But mostly, no, you don't do any medications, and you get lots and lots of overtime in the hospital.
Mm.
I know someone who was working almost 55 to 60 hours a week. Yeah, and their paychecks were like $7,000-8,000 paychecks.
Oh my God.
They weren't doing anything, right?
Hmm?
They weren't really doing anything hard. They were just there, like, if let's, for example, if I want to work nighttime,
Mm-hmm.
what do I do? Like, what's the routines that I have to do?
Night,
If it's
like there's a like mostly all us nurses we used to work 12-hour shift. Either 7 a.m. to 7 p.m., 7 p.m. to 7 a.m. My hospital shift was 2-day shift, 2 night shift. Night, we get in, the RCAs, they come at 11. The RCAs were 8-hour shifts, and they come at 11, they just assist. And about 2 in the morning, we do our rounds. So there's be 25 patients in one unit. So you go first assess from assist 1 to say 1 to 1:30, you assist nest 1 to help her with the changes. And most of the time, if they are independent, there's nothing for the RCAs. We just do like when we go in, we do the medication, bedtime medication, put them to sleep. We there in case they complain of pain, we give them pain medication, sleeping medication. But the RCAs, they just come assist the nurses. Like most of the client, like if they're incontinent, it's 2% assist. So one just turns it, and the other one just changes the pads. So you need 2 people. Sometimes you have only 15 patients, especially coming Monday, Tuesday. They all get discharged, and you're just there, like, there's so many things I cannot, like we all take breaks, like when you walk emerge, you
Mhm.
take 3 hour breaks. So each of us, it depends on your team partner. Like, we will say, okay, I'll do my rounds from 1 to 1:30. Then you help that person 2 to 2, and then they take a break, like, go sleep for 2-3 hours. And then that's how we work in the hospitals.
okay.
Yeah. But yeah, it depends on you. So if you are in the emerge, then you might be taking your 2 hour break. But yeah, it's hospital, like for the RCAs, hospital is easier. For the RCAs, long term is because you're getting 7 to 8, 6 to 7 per residence you have to take care of. But if you end up in like with me, like in the deployment, you're only doing one-on-one.
Oh,
So you're gonna be taking care of someone until there's a long-term care available for them, which is like, and then it's busy, like, because instead of keeping them in the hospital, they send them home, and then they send the RCAs with the deployment team just to look after them at home, and it's very easy. But with ours, you need a car because
oh,
you're not gonna be in one spot. You're gonna be driving from here to there, anywhere. So if you join us, right now, as I mentioned, we're hiring quite a bit. The starting rate is 28.62 for RCA, and
oh,
and then you get 12.5% in the lieu of benefit until you become a full time, which takes about 6 to 8 months. But you're gonna be getting full time hours, like 40 hours a week,
yeah.
and so. But only thing is varies. You're gonna be either for the first 6 months, you're gonna be placed any shift. So whatever is there, one week you might work 3 to 11, the next week you might be working 11 p.m. to 7 a.m. So just for 6 months, you're gonna go, and once you get your full-time line, and then you are given choice which shift you want to work, and based on the seniority that gets assigned. For the casual, like if you in the beginning, the casuals, they're members of the HEU union, and your seniority is counted by the hours work. So even somebody who started 3 months ago, you might bump them because you are working extra hours and then the hours get accumulated. For us, like being full-time is based on the date of hire because we are under BCNU. All the nurses are under BCNU. All the curates and the RCAs are under, and support workers are under HEU. So for us, like, same procedure applies if there are some casual nurses that are still there, and their seniority gets counted on hours worked. Until you become full-time, then it's the date of hire. And
So for student, is it possible to do part-time job?
and with the deployment, no, they will need your full-time hours. But you can work as a part-time, yeah. You can work anywhere as a part-time. Or just
Healthcare assistant?
Hmm?
As a healthcare assistant, can we do part-time job?
Yeah, you can do hospitals, you can do part-time, you can work in long-term care. Like lots of them, they who are in school, they take Friday, Saturday, Sunday. They say, right? So Friday 3 to 11, Saturday any shift, Sunday any shift, and then Monday to Friday they're going to school.
Oh,
So
okay.
3 days, yeah, there's always like availability. Just tell them you're only available Friday evening, Saturday anytime, Sunday anytime. Because I also work like in a Bikana lodge, and I did let them know, okay, I'm available this shift. I take my days off, and I tell them that, like, you give the month's availability, and then they call you if they need you.
Oh.
Yeah.
Mhm.
But that's, you guys choose the right, like, healthcare, you never got to lay. I've been doing this for about 25, 26 years now, and not a single time I got laid off. Yeah. And I work overtime like crazy. Like I was mentioning, this weekend, today is Tuesday.
Mhm.
I went to Hope. I started at 7 in the morning. I worked until 11 p.m. I slept there from 11 to 6 a.m. Then I started again at 7. I worked until 11 p.m. And then I slept there again, and I worked 7 to 3 on Sunday. So I
Oh.
basically did 40 hours in 3 days. So that's 16 hours overtime, and it's double time for me. Like any overtime is double time if you're in the Fraser Health. So yeah, it's good big money. It's 2 shifts. It's gonna put me $1,600 extra
Mhm.
just working 2 shifts. And after tax, I'll bring extra 1,000 home. So why not?
Yeah. I think even our teacher Embrim, she's working really hard.
Yeah. Because one overtime shift on you, because I'm on the maximum rate, and one overtime shift, my check every 2 weeks goes to about 6,000, and after tax I bring home about 44,000 home net pay.
Oh,
Yeah, so yeah, that's more than enough. Yeah, so
like stuck around 2000 for tax.
yeah,
Oh my God, that's too huge.
yeah. Right now, like you tax and then the CPP, and then also we have everything PI, everything gets deducted, and it's around 2,000 goes into taxes. So it's still like I'm otherwise my net pay gross would be around about 3,600, and after tax I bring home about 2,800. That's even I just work regular, but just doing one shift extra, you extra grand.
Yeah, that's good. Sir, I just heard like we have to do some training for CPR.
Yes.
Is it a separate training or is it included in this package?
No, you have to go. That's totally separate. It's 2 day, 2 days you're gonna work and do that, and it's mandatory. We still have to, like mine. It's only good for 2 years, and after 2 years I have to go pay and get it done. So I normally do it at St. John's, and before it expires, you want to do it because you only have to do 1 day. But if it
Oh,
expires, then you have to do the whole thing again. But yeah, most of the time, wherever you like, if you end up in long-term care, they arrange it right there in the long-term care, and they will just do it in a group.
Okay.
That's mandatory. Any healthcare worker, it's mandatory to have that because you're gonna be, just in case somebody, your patient you're looking goes into cardiac arrest, like getting heart attack, so you know how to revive them. Even you're walking on the street, somebody's passed out, you know what to do, things like that.
So what kind of, like any other trainings necessary for this?
Yeah,
Yeah.
you need the WIMUS, which is another thing, like how to, like where to find is the chemicals that used in the hospital. You need to know about them, and what is the first aid, like in case you have a spill of, say, sanitizer or Suboxone or something in your eye. You need to know what to do to or help your coworker. WIMUS, first, like the first aid is mandatory, and WIMUS they will train you at this hospital. But if you end up in Fraser Health, for example, if you do the training, they will reimburse you for
Oh.
the training because it's mandatory. Anything that's mandatory, they will reimburse you the money. Like for me, my nursing license, I paid about $800 every year to renew it in February, and Fraser Health reimburses me that money. So I get the money back from them because it's mandatory for me to have my license to practice. And without that license, I won't be able to teach you.
Okay. So like that means we can wait until we get certificate.
No,
Like what
I think before you're gonna go in your practicum, you have to have that.
Oh, okay.
Yeah, before you go for your training practicum, you need to have that because the facility you're gonna go, that's one of the requirements. You have to have first aid.
That means CPR. What about food handlers? Food safety training, something like that.
No, food safe. No, it's not mandatory, but yeah, if you end up in a group home, then you need the food safes. But you can do that online. And there's lots of places they can do the food safe training. And I did mine online. Is go to British Columbia government site. There's a food safe training, and then you do that, do the exam, and then they will email you the certificate. Just print the certificate, and it's good for life.
Okay, thank you, sir.
Yeah, but first aid you have to go in class because you need to know how to pump like babies, how to survive, like those ones are on hand training, and we must do like where you're gonna find the first aid treatment, just like your partner maybe have washing the hand and they use some chemicals, and if you splash on your eye or face, you need to know what to do with the first aid.
I think it would be, grateful if any of you, like teachers or even Ron, you guys can just share in a group chat, like the necessary trainings needed.
Yeah, that's the two. I think the schools will send you like what is needed, and maybe set up for you a training somewhere.
Oh, okay.
Yeah, that's what they've been doing for other students I know in past, that they send them in a group, and then
Yeah, that's better.
it's better. This Vancouver one, there's one on Clark Drive. It's called Pacific Healthcare. They do first aid training, and they're very cheap too.
Oh.
Yeah, I did my refresher there because I wasn't able. Mine was about to expire, and then I couldn't find anywhere to go because during COVID everything was like they stopped, and that's the only place I could find. Then I did my refresher because I have to have a valid. I always carry in a wallet, and you have to have a valid first aid.
British Columbia government.
Yeah, the food safe training, you can do it on there.
Yes.
Just Google it, food safe training, and you can do it online. You don't need to go in the class. You read material, like what is there, and then just answer the questions. And once you pass, they will send you the certificate. Some are free, some you have to pay like 50-60 bucks. Depends where you're going to do it.
Okay.
I don't know if that the British Columbia government one is still valid. Any other questions?
No.
It's a good time to, get your knowledge, whatever you need. Yeah.
So like for the exams, do we have to keep all the science term? Do you have to know it all?
No. That
What's
was
the prepared for the exam?
we'll set it up, because I want to do it halfway and then at the end. So just as long as you keep doing your chapter review questions in your book and the chapter end, you're going to do fine. And what I said, like, when we discuss that, like, just make sure just review, because the questions will come from those.
Oh.
Yeah. And just keep keep reviewing it, and that's all you do. And the way I used to study is I used to pre-read a day before what I'm supposed to do in the daytime, and then
Mhm.
when I come home I used to make my own notes.
Oh, okay.
I take the PowerPoints. I don't rely on the PowerPoint. PowerPoints are just the basics of the explanation. Then I would make my own note and keep it. So when before my exam, I would read my own note, and then it refreshed my memory. Yeah, nursing was hard. The hardest one I did in the nursing is remembering all the medications. That was one of the, and then you have to get 90% in order to pass.
Oh, out of 100?
Out of 100, yeah.
Oh my God, really?
Yeah, medications, especially, like we have to know what medication and what are the side effects. And another thing, if you're going math, you need to get 100% drug calculations. You have to get 100% in order to advance. So if you're studying nursing, the first semester you'll have to do that nursing math, like how to do drug calculation.
Oh.
You have to get 100% on that, and then for the health and healing medications, you need to get 90% in order to pass. That's the government regulation, especially with the math and medications. But trust me, once you learn the medication, you're never going to forget your life in your life. Yeah. Mhm.
So like we have already completed like almost half of the total chapters.
Mhm.
So we are left with like 5 months. What we gonna do?
Yeah. There will be exam coming up. I don't know how we're gonna do it, but yeah, soon it's gonna come.
Okay.
Just gonna see if I can if I see. Yeah. Let me see. Question bank. Give me 1 second, guys. Just gonna... You guys have access to Evolve, right?
Yes.
Yeah, but we don't see what you see. We cannot like
Yeah.
No, that's won't evolve. Like I have the instructor access, but you can go on the question bank and you can review those questions each chapter. You guys see the question bank when you log in?
Um,
Yeah, you guys should be able to see the question bank. It's right here. Can you see on my screen?
Yes.
Yeah, so go on question bank and there's multiple choice and just keep doing that. Review chapter, all this like you did today you did say 31. There's no question. 30. Oh, questions. So this is where we're gonna take out the questions from to make the test. So just review these questions. Once you review this, it shouldn't be a problem for you guys. Let's do a critical thinking. 19. One, unity elimination. Okay. You guys can see my screen. Chapter 29. Right? You are assisting in a care of an infant who has not had a wet diaper for 6 hours. Is this acceptable or no? You guys can read it on my screen?
no, I don't see.
No, we cannot see question.
Okay, let me share this again.
I think you have to reshare the screen.
These are some critical thinking questions. You can see it now?
Oh, yes.
Okay, so scenario 1, what do you think? Is it acceptable you changing a diaper for an infant who
No,
has
it's
not?
not acceptable.
Okay,
That
so
was too long.
that's too long. Yeah, that means that the infant is dehydrated. There's not enough.
Dehydrated, yeah, maybe.
Yeah. You are caring for a client with indwelling catheter, right? Either be Foley or suprapubic. As the client returns from radiology department, you note that the collection bag on the side rail, after assuming that the client is comfortable back in bed, you also note that the securing device is gone. What you should do? The securing device is on the thigh. We put this little tape, and then the catheter goes on top, and then you lock it so the tubing doesn't. As RCA, what are you gonna do if you notice this?
Let the nurse know.
Exactly. Let the nurse know that it just came from the cat. You don't see the security device is gone. All they can do is just ask for another. It's called what is the name for that? It's a special name for that. And then you just peel the tape, put it on the thigh, and put the tube between, and just lock it. Okay. Yeah. Okay. And question 3, scenario. You are assisting a client to obtain a clean voided urine specimen. The client accidentally puts a tissue in the collection container. What do you do?
Do I take it out or do I tell the nurse?
No, you're gonna discard that because it's already contaminated. So you're gonna discard, let the patient know that in next, and then wait for next time he goes to void. So the specimen you have in the urine hat, they call it, that put into the toilet, you're gonna discard that, wash the urine hat, and put it there again. Okay? Because the urine is already contaminated, so you cannot be, you won't be able to use that urine. Okay, scenario 4. You are assisting with the 24-hour urine collection assigned under your care. The client is in the dining room and chooses not to return to his room to the collection specimen. Instead of, he voids in the nearest bathroom. Is it okay to collect an extra sample and continue the collection?
No.
Yeah, mostly the 24-hour collection is for to test the ketones, especially the ones who are diabetic. That's the when they do the 24-hour collection. But if he has voided, you still do it for 24 hours. That can be like whatever you collected, that can be sent to the lab to check for ketones. Okay. Sounds good. Let's do another one. Bowel elimination. You are assisting with care of a newborn infant. Your 12-hour shift is almost over and the infant had not had a bowel movement. What is the correct action?
We'll have to inform the other person who is in next shift.
Yes, and then also you're gonna inform your nurse, whoever is the charge nurse. Most of the time, you're gonna be doing this in a home support. You're doing respite. Let the family member, most of the time the home support, they go look after infant. It gives the mother a break to go do the shopping, do the chores, and RCA goes look after the infant. It's pretty common. You're gonna, if you end up in home support, you might be doing this. So yeah, you have no, like, you cannot give them any medication. Don't do anything. Just let the next to kin, the caregiver, that so and so did not have any bowel movement in so long. Okay. So why don't you guys take 5 minutes washroom break, and then we'll come back and we'll discuss this. Okay. Okay. You are caring for a client with cholestatic deficit. What precautions should you follow? Remember I mentioned C. diff? That's what it is.
Yeah.
Yeah. C. diff is a GI infection. It's very, very contagious. If there's a GI outbreak, you have to use the standard precaution. You're gonna isolate that patient because it's very radioactive, and you will use your glasses, mask, gloves, gown before you're gonna take care of that person. This is the common term is known as C. diff because they will be on vancomycin. It's one of the strongest antibiotic known, and it's gonna smell like really bad. Okay. You are caring for a 13-year-old girl. The mother is consulting with physician in her office. Upon returning to the exam room, you find the girl and her boyfriend in a heated discussion. You hear him calling her names, see him holding her by the wrist, and hear him threatening her. What are you gonna do? This is a very common thing happening. What are you gonna do? Let's have a discussion. First thing you're gonna do is de-escalate. Ask the boyfriend to leave the room.
And then I would talk to the 13-year-old girl and ask her what's going on.
Anybody under 18, you need a consent.
Oh yeah, okay. 13. I thought you said 18.
No, 13-year-old. You have to get a consent, let the mother know, and you can ask the boyfriend to leave the room. And if there's worse, you have security, call the security. Because he has nothing to do with your patient. You are there for your patient, which is a 13-year-old. Let the mother know, and let the mother know that this is what's happening, and but you cannot ask anyone who's under 18. You have to get a consent first from the parents. Okay. Okay, let's try to do the next one. This is the one we did today. Oh no, you haven't done this 33 yet, right?
Not 32, we did 31. We did only 30. Is it 31 or 30?
That was the growth and development, 31. Any other chapter you want to review? Nutrition, you guys done?
Yeah.
I missed yesterday classes, so could you?
Bowel elimination is one of the most important class.
Yeah, you can just explain some important things, like briefly.
Yeah. You know what we did? Like No, on the book, we did the question and answer. It
Mhm.
kind of covered everything.
Mm.
Yeah. So yeah, just read through your book and then review your question and answers. Yeah, those are important. Like the most common you're gonna see in elderly is fecal infection, constipation, and certain people like their normal bowel movement is just two to 3 days. Um, they're normal, so you don't have to worry about anything. Let's see, which other topic you guys want to go? Okay, medical terminology.
This one.
Right? Huh?
We didn't do this. The teacher skipped some of the chapters, so I don't know, but she skipped them.
Maybe we can. I think teacher said that we will be doing that. It's a short chapters, so we will be doing at the end.
Yeah.
Yeah, because medical terminology, I went through most of them with you guys, and so it's pretty straightforward. Once you know it, you're gonna remember. Personal hygiene, prevent infection control. Yeah, this is a good one. I did with you. You are caring for a client with upper respiratory infection. What are some conditions for upper respiratories? Bronchitis. And lower respiratory is peripheral edema, angioedema, uh, as a COPD, like TB, they affect the lower part of the body. Upper is bronchitis mostly. You have been in the room assisting the client numerous times during your shift. As you leave the room, you cannot remember if you have performed hand hygiene. What action you will take, and how could forgetting this skill harm a person and others? Forgot to do a hand hygiene. What are you gonna do? Shoot. This is just a discussion. It's not a test.
Mhm.
First thing you're gonna do is wash your hand because you don't know if you have done it or no. Okay. The second thing you're gonna do is the risk you're gonna carry because bronchitis is contagious. Have you had that strep throat? Remember the terms? I have strep throat, and it's caused by Staphylococcus aureus. It's one of the really bad bacteria, which can be infected and um, can be transferred to some other person really fast. Okay. So the way you could have harmed somebody if you went to another client or another patient, you could have transferred the virus to the new client. And if this client, whoever you transferred, if they have COPDs, so COPD stands for chronic obstructive pulmonary disease, like asthma or something, that person can die from it. Okay. So if you have don't remember, just wash your hands and this action could have happened. So you are assigned to treat a methicillin-resistant infection in the wound. The nurse has provided you with little information. What type of precaution you need to take? What questions will you ask to learn the proper ways? So anybody who has MRSA, you need a standard precaution. There will be a signage on the door. It's a purple sign. It's mandatory. If you're in any way you're gonna go, they have to inform you that this person you're going to take care is has MRSA. So you have to use the standard precaution. Standard precaution is you have to glove, gown, mask, and eye protection. And you have to really wash your hands before you leave the room, because if you go to get into somebody else, they can easily be carried. Methicillin is a type of antibiotic that's used in so the bacteria is resistant to most of them. So to find out like what kind of bacteria, we send the wound swab to the lab, and they test it against the antibiotics that could be used. So when you get the results back, it will indicate the antibiotics, and it will say R or S. The R means they are resistive to that antibiotic. S means they're susceptible. So the one with the S, that's when their doctors used to prescribe the antibiotic. Same thing with the urine test, CNS goes. Are there any other tests? They test it against the antibiotic. They will first test what kind of bacteria it is, and they will test it against the antibiotics. Okay. Because you don't have to worry too much, because if it's in the wound, then the nurse who does the wound care has to, for your own protection, use the standard precaution. Sounds like a plan? Okay, so if you guys have any questions, just message me on WhatsApp and I will be able to help you. I gave you my email last time, my Fraser Health email. If you have anything, just email me and I will call you back or something to help you with.
Sir, are you in the group?
Yeah.
WhatsApp group?
Yeah. I should be. Yeah. I'm the one who said good morning, sir, at 8.
Oh, okay.
8:14.
Kumar, okay, sir.
That's me. Yeah, just send me a message, whatever, and that's it for the day. I give you guys 15 minutes to relax. Okay.
Okay, sir. Thank you.
Yeah, these guys, if you're doing your homework and stuff, just message me if you don't understand something.
Okay, sir.
And definitely will help you. Okay, you guys have a wonderful evening, and I'll see you tomorrow morning.
Okay, sir. Thank you. Same to you.
Thank you.
You're welcome.